There are three types of antimicrobial drugs, and these are: number 1, antibacterial drugs; number 2, antifungal drugs; and number 3, antiviral drugs. Antibiotics are chemicals produced by microorganisms that inhibit other microorganisms. By this definition, most antibacterial drugs discussed here are antibiotics. Antibacterial drugs are classified as either bactericidal or bacteriostatic. Cidal drugs kill bacteria, whereas static drugs prevent growth of bacteria. These descriptions are applied to the concentrations of each drug that can reliably be attained in vivo. The spectrum of any antimicrobial drug refers to the extent. It could be broad, extended, or narrow of the organisms affected by the drug and the specific organisms affected. Extended therapy with a specific drug almost always leads to some resistance of certain organisms to that drug. Superinfection, defined as the growth of resistant organisms owing to therapy targeting sensitive organisms, is usually more likely to occur with broad spectrum or extended spectrum drugs compared with narrow spectrum drugs. The potency of antibacterial drugs is often estimated using measures such as the minimum inhibitory concentrations, or what we call as MIC. Mechanisms of action and characteristic adverse effects of antibacterial drugs are as follows. Stage 3 in cell wall synthesis is inhibited in penicillins. The mechanism of action is transpeptidase, and the adverse effects are allergies, neurotoxicity in high doses. Stage 3 in cell wall synthesis is also inhibited in cephalosporins. The mechanism of action is transpeptidase, and the adverse effects are allergies, neurotoxicity in high doses, and renal toxicity. Translocation step of ribosomal protein synthesis is inhibited in macrolides drug, and the adverse effects are gastrointestinal upset, especially with erythromycin, inhibition of drug metabolism, and QT prolongation. Peptide bond formation in ribosomes is inhibited in clindamycin drug, and the adverse effects are diarrhea and pseudomembranous colitis. Binding of amino acyl tRNA to ribosome and protein synthesis is inhibited in tetracycline's drug, and the adverse effects are tooth staining, liver toxicity in pregnancy, photosensitivity, and Fanconi's syndrome with outdated drug. Dihydropteroate synthase step in folic acid synthesis is inhibited in sulfonamide's drug, and the adverse effects are crystalluria, allergies, and psychosis. Peptide bond formation in ribosomes is inhibited in streptogrammin's drug, and the adverse effects are phlebitis, myalgia, and arthralgia. tRNA binding to ribosome and initiations of protein synthesis is inhibited in Linezolid drug, and the adverse effects are myelosuppression, gastrointestinal effects, and peripheral neuropathies. Dihydrofolate reductase step in folic acid synthesis is inhibited in Trimethoprim drug, and the adverse effects are megaloblastic anemia and leukopenia. The mechanism of actions of fluoroquinolone's drug are transcription and DNA gyrase and topoisomerase intravenous. The adverse effects are gastrointestinal upset, central nervous system toxicity, and photosensitivity. Initiation complex of protein synthesis and cause misreading in protein synthesis are inhibited in Aminoglycoside's drugs, and the adverse effects are renal toxicity, ototoxicity, and neuromuscular blockade. Transglycosylase in cell wall synthesis is inhibited in Vancomycin drug, and the adverse effects are renal toxicity, ototoxicity, and Redmond syndrome. Damages DNA after being reduced by nitroreductase is inhibited in Metronidazole drug, and the adverse effects are gastrointestinal effects, metallic taste, and oral candidiasis. Peptide bond formation in ribosomes is inhibited in Chloramphenicol drug, and the adverse effects are bone marrow hypoplasia, aplastic anemia, and gray baby syndrome. Bacitracin drug inhibits bactoprenol in cell wall synthesis. this is used topically, so there is rare adverse effects.